Breast cancer starts when cells in the breast begin to grow out of control. These cells usually form a tumor that can often be seen on an X-ray or felt as a lump. The tumor is malignant cancer if the cells can grow into, invade surrounding tissues or spread, metastasize to distant areas of the body. Breast cancer occurs almost entirely in women, but men can get breast cancer, too. Cells in nearly any part of the body can become cancer and can spread to other areas. To learn more about cancer and how all cancers start and spread, see Cancer Basics. Where breast cancer starts. Breast cancers can start from different parts of the breast. Most breast cancers begin in the ducts that carry milk to the nipple, ductal cancers. Some start in the glands that make breast milk, lobular cancers. There are also other types of breast cancer that are less common. A small number of cancers start in other tissues in the breast. These cancers are called sarcomas and lymphomas and are not really thought of as breast cancers. Although many types of breast cancer can cause a lump in the breast, not all do. Many breast cancers are found on screening mammograms, which can detect cancers at an earlier stage, often before they can be felt, and before symptoms develop. There are other symptoms of breast cancer you should watch for and report to a healthcare provider. It's also important to understand that most breast lumps are benign and not cancer, malignant. Non-cancerous breast tumors are abnormal growths, but they do not spread outside of the breast and they are not life-threatening. But some benign breast lumps can increase a woman's risk of getting breast cancer. Any breast lump or change needs to be checked by a healthcare professional to determine if it is benign or malignant cancer, and if it might affect your future cancer risk. Breast cancer can spread when the cancer cells get into the blood or lymph system and are carried to other parts of the body. The lymph system is a network of lymph, or lymphatic, vessels found throughout the body that connects lymph nodes, small bean-shaped collections of immune system cells. The clear fluid inside the lymph vessels, called lymph, contains tissue byproducts and waste material, as well as immune system cells. The lymph vessels carry lymph fluid away from the breast. In the case of breast cancer, cancer cells can enter those lymph vessels and start to grow in lymph nodes. Most of the lymph vessels of the breast drain into lymph nodes under the arm, axillary nodes, lymph nodes around the collarbone, supraclavicular, above the collarbone, and infraclavicular, below the collarbone, lymph nodes inside the chest near the breastbone, internal mammary lymph nodes. If cancer cells have spread to your lymph nodes, there is a higher chance that the cells could have traveled through the lymph system and spread, metastasized, to other parts of your body. The more lymph nodes with breast cancer cells, the more likely it is that the cancer may be found in other organs. Because of this, finding cancer in one or more lymph nodes often affects your treatment plan. Usually, you will need surgery to remove one or more lymph nodes to know whether the cancer has spread. Still, not all women with cancer cells in their lymph nodes develop metastasis, and some women with no cancer cells in their lymph nodes develop metastasis later.